Today I wanted to talk about practices, so things that you can do to help improve your sleep. And so when I'm talking to patients about improving their sleep and different practices that they can do beyond creating the sleep sanctuary, we want to look at getting up early in the morning, viewing sunlight. We need to make sure or try to at least have a regular time that we are getting up and time that we're going to bed, and to help set that circadian rhythm. We want to view sunlight within 30 minutes or an hour, preferably 30 minutes of waking up in the morning. And so my recommendation would be to get up somewhere between 6 and 7 a.m. Obviously, depending on your work schedule, school schedule, kids, other things in life, that's going to vary. But I would try to make sure that you are getting up as close as possible to the same time every morning. Then you want to get bright light in your eyes, and sunlight is best, and it's best if it is at a low solar angle. So again, early morning sunlight, 6 to 7 a.m. would be my recommendation. And so you're setting with that low solar angle, you're setting circadian rhythms and telling your body that this is the time for your cortisol to be up. And so then it is getting into a circadian rhythm of about 16 hours later. Your body's going to be going, okay, we were up and we saw that early morning sunlight, and now it's time to start shutting down. It's time to increase melatonin production and things like that. We also, it's also a good idea to view the sun at dusk as well. That also helps to correct and set and let your body know that you're on the right circadian rhythm. So early morning sunlight, and then that sunlight again, that low solar angle sunlight at dusk helps to tell the brain that it's soon going to be time to go to bed. We actually need 8 hours of darkness. So you want to make sure, again, I talked about it in the sleep sanctuary video, but you need to have the bedroom as dark as you can possibly get it. But for proper sleep, for getting proper restorative sleep, you want to get 8 hours of darkness as well. Caffeine. Another practice in relationship to sleep: no caffeine within 8 hours of your bedtime. And so if you're getting up at between 6 and 7 a.m., then you should be going to bed between 10 and 11 p.m. And actually going to bed a little bit earlier than that might actually be beneficial. There is some research to show that going to bed in correlation with light dark cycles can help support more restorative sleep, more quality, more quantity of sleep. Don't eat anything within 3 hours of going to bed. Definitely stay away from heavy meals or high sugar meals because that can disturb your sleep. No alcohol. Drinking alcohol, we know, negatively affects particularly the quality of your sleep. It may not affect your ability to go to sleep, but it's probably going to affect your ability to stay asleep, and it's definitely going to affect your quality of sleep. If you are having a difficult time getting up in the morning, try to do 30 minutes of try to exercise within 30 minutes of getting up. So if you can go outside, no sunglasses, go for a 30-minute walk, get that low solar angle sunlight, and the exercise helps to stimulate cortisol, and that is that hormone that gets us up and gets us going in the morning. So again, exercise within 30 minutes of waking up can help stimulate cortisol. So that's another practice that can help with sleep, because cortisol should come up in the morning, and then it should start going down over the course of the day, and then be lowest as we're going to bed at night. Stay off of screens within an hour of bedtime. So no telephones, laptops, computers, TVs if possible. Stay off the screens. That way you're not getting that light stimulation to the eye. Dim the lights in your house. If it's dark outside, make it as dark as possible inside the house, and that will help to set those circadian rhythms and help you prepare for bedtime. Again, you can use like some blue blocking type glasses as well to cut down on the amount of blue stimulation to the eye, and that's going to help with setting the circadian rhythms as well. Yoga Nidra, meditation, non-sleep deep rest. These are all things that you can do during the day if you have time that can help with your quality of sleep. Research shows that doing these practices as often as daily, but probably at least 2 or 3 days a week, and anywhere from 10 minutes to an hour can be beneficial for particularly the quality of your sleep. And so if you're sleeping but you don't wake up feeling rested, you might try some Yoga Nidra meditation, NSDR. If you haven't heard of Andrew Huberman, Google or go to YouTube, NSDR, Andrew Huberman, and he's got a good thing on there for that. Coloring. I know that you may think this sounds crazy, but coloring, doesn't have to be fancy, doesn't have to be an adult coloring book or anything. Just getting a regular old coloring book, colors, and spending 30 minutes coloring can do similar things as meditation. We get into the same brainwave state when we are coloring as when we're doing meditation. So if the idea of sitting and meditating is something that you think you just couldn't do, you might try coloring. So I'm sure there are probably other practices. If you have other suggestions for practices, please leave them in the comments. If you have questions for me about practices, or you're not sure that you understand what it is that I'm talking about, please leave comments, and I will answer them as quickly and as best I can. Again, I'm sure there's probably other practices that can help with sleep, but these are the practices that I recommend to my patients, and so I hope these help. And again, any comments or questions, leave them below. Thanks.